Good morning, ladies and gentlemen, and thank you for your interest for ADOCIA, which is an innovative company dedicated to diabetes and obesity. And after the first disclaimer, ADOCIA has been co-founded by Gérard, my father, Rémi, my brother, and myself almost 20 years ago, and we are developing biomedicines for metabolic diseases. And we are all located in Lyon, France, listed on Euronext since 2012. With 80 people, 35 PhD. We have received $135 million in partnership as our business model is B2B, and we have 25 patent families as an innovative company. We can summarize our pipeline with short-term catalyst and partner programs. And the two first short-term catalysts are M1 Pram, which is a unique treatment for obesity in insulin-dependent people. And we have received an option from Sanofi to agree on a global partnership on this program. ADOCIA Islet is a cell therapy technology to implant cells without immunosuppressors, and we are preparing this year our first human trial that should be launched next year. And we are also discussing with potential partners on this technology. So the two partner programs are two innovative insulins, BC Lispro, which is an ultra-rapid insulin, and the phase 3 should end this year, triggering $10 million milestones, plus $20 million milestone until approval, plus double-digit royalties. And thanks to the partner, Tonghua Dongbao, which is a leading company in China. We have a second program partner with Tonghua Dongbao, BC Combo, which is a unique co-formulation of a long-acting insulin and a fast-acting insulin, Glargine and Lispro, and we should start the first phase 3 this year, triggering a $10 million milestone, and $40 million milestone should come after with double-digit royalties. We have also a next wave of innovation in obesity, MASH, and diabetes by developing two new technologies, one for oral delivery of GLP-1, competing with Rybelsus of Novo, and we have an ongoing feasibility study with a partner, and Adel, which is an extended release technology of GLP-1, unique in the sense that it's fully in water. But we will not share any results on these two platforms today. Let's come back to M1 Pram, which is the first co-formulation of insulin and amylin. And it aims to address the unmet medical need of obesity in insulin-dependent people. We did twice the cover of DOM, Diabetes, Obesity and Metabolism scientific journal with these clinical results on this program. Everyone is aware of the revolution of satiety hormones thanks to the tremendous success of GLP-1. But there is another class of satiety hormones, not yet so well known, which is the amylin. As you may know, amylin is secreted by beta cells from the pancreas. Both classes of hormones trigger a decrease of appetite, a decrease of food intake, and a delay of gastric emptying. And as a consequence, that is translated in weight loss, good glycemic control, and cardiovascular benefits. What you have to know is that GLP-1 first role is to stimulate beta cells that secrete amylin. So obviously, that's a treatment of choice for everyone who has beta cells, so the general population, type 2D, but in fact, type 1D who have no functioning beta cells or very limited number of functioning beta cells are not allowed to take these GLP-1 like semaglutide and tirzepatide. So GLP-1 are not approved for type 1D. In fact, for this population, without beta cells, the preferred choice is to replace the missing amylin. So amylin is the treatment of choice for people without beta cells. So all type 1D, because all type 1D are insulin dependent, and a small portion of type 2D, approximately 5% of type 2D, have lost their beta cells. That's generally at the end of the disease, and that's it's a serious situation, because insulin dependency is a life-threatening condition. So amylin is the hormone of choice for obesity in people without beta cells, and so we have developed M1 Pram to address this unmet medical need of insulin-dependent people with obesity. And the value proposition is very simple. In fact, it's just to replace an insulin pen by another insulin pen containing amylin. By doing so, we claim to offer the same glycemic control with the same risk of hypo, the same number of injections, no additional treatment, same local tolerance. But big difference is your insulin, as it's a growth hormone, is causing weight gain. Whereas here, an insulin combined with amylin will offer weight loss. And this weight loss, you will see, is comparable to GLP-1. It's also associated to a sparing effect on prandial insulin dose that has been decreased by 20%. And it's also reported an excellent patient satisfaction. So M1 Pram intends to treat obesity by simply replacing a usual mealtime insulin. What we have seen in phase 2 results in a subpopulation of obese type 1D is a weight loss of 5.5 kilo after 4 months. Unfortunately, as I said, we cannot compare these results to the effect of GLP-1 in the same population because they have not been tested in type 1D. And so, and for good reason, in fact, because in the early days of development of GLP-1, Novo have observed the risk of hyperglycemia associated to ketosis and risk of hypoglycemia by using GLP-1 in this population. Even we cannot even compare these results to type 2D taking mealtime insulin, because, as I say, because these insulin-dependent type 2 have been excluded from phase 3 recruitment. So the closest population we can compare with is the population of type 2D taking basal insulin. And in this population, semaglutide offered a 4.5 kilo loss after 4 months, and tirzepatide a 5.6 kilo loss after 4 months. So very similar to the results we got. So M1 Pram is potential first-line treatment for people with obesity under intensive insulin therapy. So, as I said, it's an unmet medical need because it's not approved by FDA and EMA. It's chronic, and unlike GLP-1, it's a vital treatment. It's a life-saving drug. So, in fact, if you intend to stop such a treatment, you have to replace it by a regular mealtime insulin, and that is will cause, of course, weight gain, as I said. So it's also a large and growing patient reservoir, and it's already 2 million of people in US suffering obesity and being insulin dependent, so both type 1D and type 2D, and that is unusual because 20 years ago there were no such obese and overweight people in type 1D population. And that's why also, according to market access experts, we should claim for price parity with GLP-1 because it's clearly an obesity drug, as efficient as GLP-1, for an unmet medical need, which is a severe comorbidity. When you are insulin dependent, being obese put at risk to develop an insulin resistance for type 1D, and that's would severely could be a severe comorbidity. So if you cross all these parameters, you have really the potential of a blockbuster. And for now, no competitive product has been identified, nor Lilly, nor neither Novo are developing their obesity drugs in type 1D. So that's why Sanofi took an option to have an exclusive negotiation with us for 10 million euro last year, and we are preparing a phase 2B in US with 140 obese type 1D. And we are also working on development in type 2D, insulin-dependent type 2D, so type 2D taking mealtime insulin. ADOCIA islet is a technology for curing type 1D without immunosuppressants, because everyone knows that there is a surgery which permits to control your diabetes by cell implantation. Unfortunately, you have to take immunosuppressants for the rest of your life, and that puts you at risk of infection and cancer and other severe adverse events. So ADOCIA islet intends to protect the cells from the immune system of the host and to be easily implantable and removable to cure diabetes. And we have created 2 oligomers that you can see on the left of the screen and that are cross-linked in presence of islets to make a thin layer hydrogel to be a barrier to the T cells, but also the antibodies, so the mediators of the immune system of the host, and to be totally transparent with a fast diffusion for small molecules mandatory for the good functioning of the cells, like oxygen, glucose, and insulin. And as it's 95% of water, it's very fragile, so it has been reinforced with a surgical mesh that you can see on the photo, and around it there is a silicone ring to suture this implant. You can roll it, you can implant it, and retrieve it easily by laparoscopy. And when you implant it in a diabetic rat, which is immunocompetent, this allograft is surviving for 132 days until explantation of the implant, and you can see that the glycemia has been controlled over this period of time, and the animal is back to diabetic when the implant is removed. So this demonstration in the animal model proves immunoprotection and functionality in vivo. And we have presented this to American Diabetes Association, European Association of Study of Diabetes, and also the International Pancreas and Islet Transplantation Association last year. And we are preparing now a clinical trial to be launched next year. And in parallel, we are discussing for partnering to apply this technology not only to human islet, but also to iPSCs. So, at the end of March of this year, the cash position was 10.2 million euro. We've signed for an equity line of 1.7 million shares, so for a maximum dilution of 10%. And so this should permit to have a cash runway until Q3 2025. And so the debt is limited to 5.6 million euro, guaranteed by the state, PGE. We have a limited number of shares, 14.3 million, and the stock price around 9 euro with a liquidity of 100,000 shares per day. And we have received $155 million from partnership, and where we have raised for the last 20 years 97 million euro. The retail is around 70% of the company, and the family and the employees are owning 13% of the shares. So this year and next year should transform the company with key inflection points. As I said, M1 Pram, which is a unique insulin offering for the first time a weight loss, and for an unmet medical need, and a discussion with Sanofi ongoing, and ambitious clinical program prepared. ADOCIA technology also should trigger a partnership this year, and the launch of the first clinical trial next year. And the last but not the least is a solid partnership with a Chinese leader in the insulin business, with $80 million milestones coming, 20 this year. And so thank you for your attention, and I'm glad to take any question if we have some time left.
Thank you very much, Olivier.